Welcome to our Mighty Dove Global Science Updates. We're in the middle of a global pandemic, and I've been asked to shed a little light on what's happening around us, how it will affect us, and how some of our wonderful supplements can help. So let's call this the COVID-19 updates. I am Dr. Jean Dillague, and I am the Chief Science Officer of Mighty Dove Global. Now, according to the Cleveland Clinic Journal of Medicine, the progression or the course of the disease is as follows. There are three stages to the COVID 19 infection. It begins with stage one, where the patient is practically asymptomatic. This is the phase when there is rapid viral replication in the cells, and until it gets to a critical point that it produces some mild, non-severe, non-discrete viral symptoms. That's phase two. And between phase one and phase two, most of the patients that are out there actually are basically asymptomatic, and or will probably have mild symptoms. I guess 80% of those who are infected will have this. But then there's a critical 10 to 15% that progresses to stage three, which is the severe stage when there is rapid inflammatory processes and the lungs are infected. We call this the hyperinflammatory phase, when there is a phenomenon called a cytokine storm. Your immune system is going crazy haywire and is attacking a lot of our cells, like your lungs, your kidneys, and your intestines. In this slide, we will find the common findings in each stage. If you're in stage one, mild symptoms that will be considered are just fever and maybe some form of diarrhea or cough. Then as you move on, you'll have shortness of breath that can end up into what we call the ARDS, or acute respiratory distress syndrome, which might progress to you being in the ICU and intubated and supported by a mechanical ventilator. Although it's a very small portion of the patients that progress towards this direction, but when they do, the fatality is really high. And so you find in this slide also the common accepted therapy that is being used out there. Recently, the antiviral remdesivir has been fast-tracked by FDA, and we have seen wonderful results, positive results for this antiviral drug. So you might be seeing this more and more in practice. So because this is a novel or a brand new virus, we know very little of what it is and what it's doing in our body. And so the world and all our scientists are in a scramble for the proper treatment or the proper way to approach this. So the first thing that they do is they look at antiviral drugs or vaccines that are already available, and they've been trying that right now. Remdesivir happens to be one of them. And the other one is also a kind of virus that works for HIV. I'd like to pause here and just say our lectures are not meant to diagnose or to treat or provide and offer any cure. It's also meant to enlighten and help you make wise decisions. So it is also always important that we follow the FDA guidelines of always being healthy and clean, taking care of your body, protect yourself by taking a shower, washing your hands, or covering your face, wearing gloves, disinfecting your surroundings, and observing the 6-foot distance that's required by law. So the less contact we have, the better it is for us until we're able to see the curve flatten, which means we have less and less cases being reported. Now, this pandemic might stay with us for a while, and so I guess we need to still be conscious of this all the time. However, besides cleanliness and hygiene, there might be some other things that we could do to protect us from this particular illness. And that's what we're going to explore right now. In this slide right here, this is from the journal Cell Death and Differentiation. They're beginning to show the perspectives of the immune response versus the COVID-19 infection. And they're saying at the early stage, all that we need to do is to boost our immune system and maybe fight or prevent the replication of the virus. But once you cross over to the severe system, where there's a cytokine storm, there's too much inflammation, the approach now is to tame the inflammation and provide support to the subject. This talk right here, this discourse, is not about the severe stage. It's all about the early stage and how we could prevent the progress to the severe stage. So what I'd like to show you are things that are being considered right now with the hope that we might benefit from this. So here's a scheme or a diagram of how the virus replicates inside our cells. So coronavirus enters or approaches a particular cell and activates it or opens it by attaching itself to a receptor, a compatible receptor, like a lock in a key. Once a compatible receptor is activated, it allows the virus to come in. And then what the virus does inside the cell is to open itself or shed its covering. And once it sheds its covering, it reveals its blueprint, its RNA and DNA. And then an enzyme called proteases. Now, look at the red arrow here. Very particular, I'd like to focus on that. Enzymes called proteases cut them into pieces so the RNA inside the cell can photocopy them, replicate them, and then bundle them up again, package them as brand new viruses that are extruded from the cell. And they do that a million times over. So viruses takes over the machinery of the cell and makes many copies of itself. And that's why it's difficult to defeat a virus because it's intracellular, which means you have to work with the cell or kill the cell sometimes in order to stop this replication. The focus of the research now is on how to prevent these viruses from duplicating itself. And one main focus that research is looking at is this enzyme called protease. All right? There are antivirals that are working right now are stopping viruses by stopping or inhibiting these enzymes. And we call these drugs protease inhibitors. Now, one in particular works against HIV. So there is already an existing drug, an HIV protease inhibitor called nelfinavir. Nelfinavir stops this enzyme from cutting into little pieces the RNA of the virus. And if you do that, you stop the replication of the virus. Guess what? This research shows the Japanese and their cohorts of scientists are now looking at the potential of protease inhibitors also against the SARS-associated coronavirus. They're looking at using this to stop the enzyme protease from cutting into little pieces coronavirus and stopping them from stopping its tracks from duplication. So that's one potential avenue right now. Also in Thailand, they're looking at the same focus, but this time they're looking at natural bioactive compounds from fungi or mushrooms as potential candidates. They know that mushrooms have a lot of biologically active chemical compounds, and many of them are protease inhibitors that could work against coronavirus. And of the long list that they've identified several. Right? This article goes on to say the compounds have with special effects against protease inhibitors, against HIV and hepatitis C are now the focus of attention. And they are excited because fungal compounds are also potential candidates as protease inhibitors. And they listed some of this. You probably, if you look closely at the names of these chemicals, you would see that many Ganoderma compounds, like Ganodriol A, triterpenes from Ganoderma, are considered now, or being considered now, for its antiviral properties. So here we are. Now, this is not exhaustive list, but this is a short list that included Ganoderma compounds as potential protease inhibitors that may stop the coronavirus from duplicating itself. Now, that's good news for us because we're very familiar with this product. All right? And so in an article published way back in 1988, they've already established that anti-H1 HIV protease substances are present, are active, and are effective from Ganoderma lucido. So that is one thing that we could do to help us get ourselves protected, have ourselves protected from coronavirus. Take some of these mushrooms. So if you already have the virus and you're in the early phase, inception phase, you might be able to curtail its replication. Now, the other way that the Ganoderma, this mushroom, can help us is to build or enhance our innate or natural immunity. And in this article published sometime in 2006, the researchers found out that Ganoderma mycelium can stimulate tumor necrosis factors A and interleukin-6. Both of these are immune boosting compounds in our body after 8 hours of treatment. So if you take the mushroom, after 8 hours, your immune system starts to build up. And then after 3 days, interferon gamma is being released in the body, and it also boosts your immune system. So these are two ways that Ganoderma can potentially help us or protect us from this COVID-19 or SARS-CoV-2 virus. So we're all familiar with Ganoderma, and our company is one of the proponents of this. We have a product called Red Reishi that you might probably want to consider taking right now more than ever, every day. So I probably will recommend 2 to 4 capsules every day to boost our immune system and potentially stop the replication of the virus in its tracks. Thank you for joining us, and thank you for listening in this short science lecture. If you have questions, please feel free to communicate with Mighty Dove Global. Have a good day.